Hello, everyone, and thank you for joining us this afternoon for our first webinar as part of our Implementation 201 series with the National Complete Streets Coalition. My name is Emiko Atherton, and I am the Director of the National Complete Streets Coalition here at Smart Growth America, and I'm so excited to present this webinar series for 2017. Last year, the National Complete Streets Steering Committee, which is composed of many organizations representing public health, design and engineering, public transit, all ages groups, and bicycle and pedestrian professionals came together to talk about what is the next stage of complete streets after a decade. And the steering committee really emphasized and wanted to highlight the implementation of complete streets and infusing equity into everything that we do, and being able to deliver that message, but also the technical assistance and knowledge throughout the United States. We're preparing right now our Best Complete Streets Policies Report of 2016, which I'm sure many of you are familiar with. And we have been counting, and we are now nearing I think over 1,200 complete streets policies in the country, which is phenomenal considering this movement is a little over a decade old. However, we want to make sure that as these 1,200 policies are implemented, people have the tools to make sure that they are accessing everyone in need, and they're doing it not just because, but because they're doing it to build transportation networks that serve everyone so that they can travel safely, so that they can have access to opportunity economically, but also for health. And one of the questions that I've received a lot is, if I'm interested in public health, how can I integrate my work and support the work of Complete Streets? Luckily, on my steering committee, which I just mentioned, I have two amazing organizations, the American Public Health Association and the Voices for Healthy Kids campaign, which is part of the American Heart Association and funded by the Robert Wood Johnson Foundation. And so instead of having this webinar series be me talking about it, I reached out to my steering committee and had Kate Robb and Tim Baskey offer to share their knowledge on really what is the role of complete streets in public health. One of the reasons that I think it's so important is that we've seen a direct link between physical inactivity and chronic disease. And we recently compiled this map which looks at the pedestrian fatality rate per 100,000 people, and the percentage of adults who are physically inactive. And we can start to see the story being told about the places that are most dangerous to walk relative to the physical inactivity of people. And so really people aren't able to walk, people aren't able to recreate and enjoy that physical space without safe places to walk, bike, take transit, and generally lead healthy lifestyles. So this is, again, a priority for the Complete Streets Health Coalition. But again, you're not here to listen to me. You're here to listen to Tim and Kate. I'm first going to introduce Tim. I had the pleasure of meeting Tim when I first came onto this job as one of the first people that reached out to me and wanted to form a partnership between public health and Complete Streets. Tim Baskey is a state and community advocacy manager for the Voices for Healthy Kids initiative at the American Heart Association. As I mentioned, he's also on my steering committee and on the executive committee. In his role at the Voices for Healthy Kids initiative, Tim provides guidance on building strong, equitable coalitions for policy campaigns around complete streets, safe routes to schools, walking and biking, early childhood education, and healthy out-of-school time. Tim has expertise in both chronic disease prevention and systems of care. Prior to joining the Voices campaign, Tim worked for the Arizona Department of Health Services to advance the Health in Arizona Policy Initiative, which embraced the principles of health in all policies while leveraging federal, state, and local funding. Tim also oversaw the development of a new chronic disease plan for Arizona. And before I turn it over to Tim, for those of you who haven't had a chance to meet him, please do. He's always all over the country, and is really one of the best advocates for complete streets, equity, and public health. And with that, I'll turn it over to you, Tim.
Oh, thanks, Emiko. I really appreciate that. So I want to thank National Complete Streets as well for having us join today's call. Really excited to connect with many of you on the role of public health within Complete Streets policies and what our role is to ensure that policies are advancing with equity in mind. So a little more background, as we all know, studies have shown that where we live and the environments in which we grew up can have a really significant impact on our overall health. So for those of us who had the privilege of growing up in a community where there were safe streets and sidewalks, where there were parks, there was reliable transportation options, where we had access to healthy food, as well as good schools and access to affordable health care, we're actually less likely to develop chronic diseases such as heart disease, diabetes, and some cancers. On the other hand, though, what we know is that if you grew up into a neighborhood where there weren't sidewalks, where there weren't parks, where you couldn't play as a child, where the schools maybe weren't able to address all of your needs, or where you didn't have access to healthy food, you're more likely to develop chronic diseases. And what's scary about it is that you're more likely to develop those chronic diseases at an earlier stage in your life. Almost everyone will be impacted by chronic disease. We know that for a fact. We know that many people, either themselves or a parent, a grandparent, sibling, or a friend, is living with a chronic disease right now. We know that 1 in 4 American deaths are due to cardiovascular disease. We know that 4 out of the 8 highest risk factors for cardiovascular disease are related to physical activity and sedentary behavior and lifestyle. But we also know that 80% of cardiovascular disease deaths are preventable by adopting healthy habits, such as being physically active, by eating healthy, by not using tobacco. And what's unfortunate is that for many communities and many families, when they don't have access to the parks, they don't have access to the affordable health care, they don't have access to the transit options that are safe and reliable, they're less likely to be active, and as I shared, they're less likely to be healthy. But there's also a lot of history that goes back within the transportation world, and so I'm going to dive a little bit deeper and go back into why and highlight why equity needs to be built into Complete Streets policies, and specifically into the performance measures as well as into the implementation. For many on the call, you're probably very aware of the past discriminatory Jim Crow policies of the 1930s tied to the Federal Housing Administration, where redlining was established, where essentially was codified within federal government, federal policy. For those that are not familiar with redlining, it's a rating system of neighborhoods where banks and lenders then use that system to determine who would receive home loans. So if you were living in a green neighborhood, a type A neighborhood, that was typically a white middle to upper class neighborhood that was on the upward swing, whereas there's a lot of growth, there's a lot of demand. It was the neighborhood to live in, and lenders wanted to give loans to people looking to buy or build in those areas because they saw a strong financial return. If you were in a type blue or a B neighborhood, then it was deemed as still a desirable neighborhood, but it's probably already reached its peak on its growth potential. So lenders would still lend to potential buyers, but at the same time, not as much as within those green areas, those green neighborhoods. And then if you start to look at the yellow neighborhoods, those were deemed as less desirable and were seen as being in the decline. These neighborhoods would often consist of immigrants, minorities, people of different ethnic descent, and lenders would more than likely not lend to people looking to build and buy in those areas. And then finally, you have the red districts, the redlining. That's where that term comes from. These were deemed to be in decline. They consisted of minority communities, predominantly Black, African American, as well as people of lower income. These neighborhoods would receive little government support or spending on infrastructure. And as a result, a systemic approach was codified in regards to segregating the white upper middle class neighborhoods from the Black neighborhoods. jumping forward, this has a lasting impact that we're still experiencing today. So the lack of housing loans actually meant lack of home ownership within those redline neighborhoods. And then there was limited transportation investment at the local level. As we all know, a lot of our tax policies and tax approaches across the country is to utilize the local tax base to go and pay for the services, to pay for the parks, the streets, to pay for the schools. So if you are in a upper class neighborhood, there's a higher tax base, whereas if you were in a redline neighborhood with limited home ownership, there is less of a tax base to go and support the needs of the community. The other thing that we know is that where there is more economic growth, there's more people wanting to move there and more businesses want to invest near there. But within redline neighborhoods, one of the things that we know is that there's limited access to employment opportunities. And also these neighborhoods were pushed up next to industrial centers. So during the unregulated era of the 20th century, many communities, many redline neighborhoods, people of color experience environmental injustice and environmental racism as they are exposed to toxins in the water, in the air, and in the ground. So you can imagine, again, that goes to that, the overall impact that has on the lasting impact on where you live can have a significant impact on your health outcomes. So jumping forward into the 1950s through the 1990s, that's where we had the great, explosion of building the interstate system, the highway system. And one of the things that we know during the 1950s through the 1990s is that entire neighborhoods were razed and torn down as they were looking to build new roads with faster movement, faster travel to go and connect the suburban neighborhoods where people start to move into the suburbs with the downtown population and economic centers. And getting up to today now, where there's been, as Emiko shared, actually 1,200 complete streets policies have been passed since 2005. And complete streets is a really forward-thinking approach of ensuring that all users, all modes, are going to have access, safe access to reliable transportation options. But one of the things that we know is that it varies across the country on the level of implementation and enforcement and reporting. And so while it has been very successful in many parts of the country, it hasn't always been equitable. So I'm going to jump and share just a little bit of some of the research that has happened over the past year that was led by the University of Illinois at Chicago Institute for Health Policy Research and Policy. And so this research was actually funded through the Healthy Eating Research, which is a national program of the Robert Johnson Foundation. And the study team, the research team, was led by Dr. Jamie Shariki, as well as with Emily Trun, who is a Master in Urban Planning on her team. This was a rapid response research project that ended up taking more than a year because of the breadth of data that was collected and just the high caliber of research that was conducted. So I'm not going to go into great detail on all this, but really excited to share some of their findings and give credit to the team that conducted this research. So this research really looked at two primary questions: a policy analysis of the 800+ complete streets policies that were in effect as of May 2015, as well as a qualitative study exploring the implementation of the policies and assessing what, if any, equitable approaches were taken. You can find the link to their full research findings at that website. And again, this is being recorded and the slides will be shared with you so you can easily access that. So out of the 828 policies that were passed, there were about 17% of them actually built in equity language. So there was some specific language that could be referred to as, without maybe even using the word equity, but prioritization of key populations, key users was built into those policies. Within their policy analysis, they did find some key findings that complete streets are less likely in municipalities that are small or medium compared to the larger population cities, which I think many of us would probably maybe argue against that, or find that correct depending on where you're coming from. But then also their research shows that when complete streets policies are in place, that there's a greater rates of walking or taking public transit to work. And there's really no significant regional differences in the population or where, in the median age of the population or where policies were being in place. One of the things that they found, though, that was interesting to me is that the prevalence of explicit equity language was, for the most part, found within resolutions. And one of the things that we know is that within resolutions, we tend to look at non-binding. They tend to be non-binding at the city level, at the municipal level. So it's more of a guidance statement to the city departments saying, whereas we would appreciate if you would implement complete streets equitably, but there really isn't any accountability built into it, generally speaking, within resolutions. And then oftentimes there would be the second highest level where we saw equity language was actually within an ordinance, within specific policy language, or an internal policy, I should say, and then also within design manuals. So this tells us that if we're going to be really successful in ensuring that complete streets is implemented, we probably need to move away from resolutions and actually go more towards an ordinance that has more binding language that builds in accountability as well as compliance. They also went and conducted qualitative interviews from key leaders from across the country, from New England down to the south, across the Midwest, over to the west. And they found some key findings there as well in regards to prioritizing transportation equity through complete streets. So some of the successes and challenges were, everyone agreed that focusing on equity is the right thing to do. It's what, the transportation leaders and the community leaders felt was the right thing to do, but they just struggled with the how. The stakeholder communication about what equity means is critical. So equity might mean one thing in Minneapolis, and it might mean another thing in Los Angeles or in Jacksonville, Florida. So what equity means really has to dive into what the community feels is equitable access. And then one of the things they also found is that communities really are trying to ensure that there's equitable access for all the neighborhoods. They also found that equity can be prioritized through other policies and programs. So connect the complete streets work to the long-range transportation plans, to the chronic disease plans, to the master plans that are taking place within those communities, to the community health assessments. Let's see, and then also funding is critical. So it's really important that with complete streets, it's to use the dollars that are available. So there's a lot of dollars that are made available, not as much as we want, but from federal, state, and local, but it's actually how you apply those dollars. But also funding should try to be secured to perhaps provide some strategic planning and training for transportation planners and for that community engagement. And I think that's where the public health community and the public health role can be emphasized. And then project prioritization should be based on the most pressing needs. And so where there hasn't been investment for decades within communities, that's where some of those needs should be, those projects should be prioritized. So the role of the public health community. So one of the things that I really like to emphasize when I'm working with organizations is to connect with the community, to bring the community voice into this discussion, but also to learn the history. So for me, from the American Heart Association Voices for Healthy Kids initiative, I don't know what's happening. I don't know the history of Atlanta as someone that's from there. So it's really important for me, if I were to go and start working with community advocates, is to actively listen and to learn from the community as far as what are their needs in their specific neighborhood, or what's happened in the past. Are they coming from a a part of the city that was redlined, or was there a major transportation project that completely disrupted their community environment? Be the expert. Remember that transportation planners and city officials, they really are not experts when it comes to public health, and we're not experts when it comes to engineering and design. So, be the expert in your respective role of really helping them connect with the community, understand the health impact, and by connecting them with some of the other efforts happening around community health assessment as well as chronic disease planning. Build public support and awareness around those needs and around the disparities that are in place. Storytelling is really critical and really important. Best way to build public support is actually to identify those authentic stories, those genuine experiences, and capture those stories and help connect them with the decision makers and others. Connect as many stakeholders as you can into the policy work, including those working on social justice, housing, education, aging, healthy food access, and healthcare advocates. So everyone should be impacted and will be impacted by Complete Streets policy. So connect as many of them as you can into the planning and the discussions from when you start to launch your Complete Streets policy campaign all the way through the passage and implementation. Be prepared for some tough discussions in relation to equitable implementation. So there are some legitimate concerns that if Complete Streets is going to be implemented within a community, it could actually cause displacement or gentrification. And that's not the goal of Complete Streets. Complete Streets is really to meet people where they are. And so there's a lot of distrust, as you can see from redlining and from past transportation projects. So there's a lot of distrust out there. So be prepared to have those honest and open discussions, and it's going to take time in many ways to build the relationships. Again, thinking about how can you prepare that story and identify those spokespeople and help those spokespeople get their story out. That's a great role for public health, going through the many different avenues that we have with grassroots and media contacts. Many people don't realize that they have subject matter expertise, and to help them leverage that on their own, help connect them into the media, into the community groups, connect them with those decision makers. And then finally, ensure that there's municipalities and states actually move forward in an accountable way with developing measures and following through on equitable implementation. So passing a policy doesn't get the policy enacted. There needs to be continued follow through and engagement to ensure that implementation takes place. So Voices for Healthy Kids, we have quite a bit of resources that are available for you. This is a website where you can go and connect to our toolkit. We have posters, we have case studies that we worked on recently with Safe Routes to School National Partnership. We have social media posts. We have guidance on how to draft a letter to the editor. We have some great new infographics that were pulled together. So these are really available to you. Connecting through that website, you can connect with us, and then we can work with you. Actually, if you want to take our logo off and you want to put your logo on, that's fine. If you want to work with us on changing out some of the language so it's going to be more reflective of your specific neighborhood or community, let us know. The only thing that we really cannot change are the graphics, but we can change any of the text as well as the logos. Here's my contact information. Please don't hesitate to reach out to me. Really excited about the work that's happening. And again, I just want to thank National Complete Streets for bringing us on the call. And I'm really excited to hear from Kate, our next speaker. But before that, on the call, I'll turn it back to you.
Thank you so much, Tim. That was fabulous. And we will have about 15 minutes for questions at the end. And I have seen your questions in the chat box. Just encouraging you again to put your questions within the chat box in your lower left-hand corner. We'll also be posting the answers to these questions in a follow-up blog post, as well as recording of the webinar. So don't fret if we don't get to your question, because we're getting so many good questions. The next person I want to introduce is Kate Robb. She's a policy analyst at the American Public Health Association, And Kate was somebody that I knew about before I met her. When I came onto the job, I was so excited to work with public health. My background is in the nexus between transportation and public health at the local level. And one of my steering committee members at the time told me, you have to meet Kate Robb, you have to get a hold of her. And so Kate and I grabbed coffee, and we immediately started talking and brainstorming about the ways that public health and complete streets can work together. So I mentioned Kate is a policy analyst at APHA. In this role, she works on the Healthy Community Design Initiatives for the Center for Public Health Policy, which includes active transportation, and healthy homes. Kate has expertise in community engagement, chronic disease prevention initiatives, and promoting walkability on a local level. Kate received her master's in science in public health from the Johns Hopkins Bloomberg School of Public Health and has a bachelor's of science in environmental and plant biology from Ohio University. So with that, I'm going to turn it over to Kate.
Wonderful. Thank you so much, and thank you for having me on this webinar. And Tim, I just want to say how excited I am about your presentation. Hopefully some of the successes you mentioned from the study you'll see in these two communities that I'll be highlighting throughout my presentation. So again, my name is Kate Robb, and I work at APHA. And I'm going to be talking to you about one of our initiatives called the Plan for Health Project. So Plan for Health connects communities across the country, funding work at the intersection of planning and public health. It's anchored by the American Planning Association chapters and the American Public Health Association affiliates. Plan for Health supports creative partnerships to build sustainable cross-sector coalitions. These coalitions are working to launch and to strengthen strategies for healthy planning. The coalitions work with communities to increase access to healthy food or increase opportunities for active living where residents live, work, and play. The project aims to build local capacity to address population health goals and promote the inclusion of health in non-traditional sectors. And like I mentioned, the coalitions are not only made up of the APA chapters and the APHA affiliates, but also local nonprofits, schools, park and recreation departments, universities, and more. So that's really important to have coalitions that are from multiple sectors. We have 35 coalitions, Plan for Health coalitions, and this map shows where they are. The red dots are from the Cohort 1 sites, and the blue dots are from the Cohort 2. And part of the application process to first become a Plan for Health grantee was to incorporate equity into the application. So the coalitions needed to use local data to identify populations at risk, such as those that had high chronic disease rates. The grantees also needed to state how they would address health inequities and involve the community throughout the process. Lastly, as part of the application process, the grantees needed to demonstrate how they would support the community as a whole and sustain this work after funding ceased. So the first Plan for Health group I'm going to talk about, they're located in Bensenville, Illinois. So here's a map of it so you can see where it is. The village of Bensenville is a suburban community of around 18,000 residents located in the northeast corner of DuPage County, Illinois, and it has a large percentage of residents at risk for negative health outcomes. The community is not reaching the recommended level of physical activity. Only 22% of 10th graders report being active for 60 minutes a day. 19% of adults self-reported no leisure time activity at all. And hospital discharge rates for type 2 diabetes indicate that the rates are 15% higher than residents of Bensenville than the county as a whole. So Be Well Bensenville, the coalition, recognized the need to focus on physical inactivity and address this by creating environmental and policy changes to enhance physical activity opportunities. The coalition specifically decided to focus on low-income and Hispanic populations to reverse the sedentary nature of the community. And as we know, as we heard from Tim, and as we know from various reports, and dangerous by design being one of them, people of color and low-income populations have a higher risk for traffic injury or death. Non-white individuals account for 34.9% of the national population, but make up 46.1% of the pedestrian deaths. So they wanted to address this and really target high-risk populations. And to do that, Bensenville expanded their coalition to include such folks as listed here on the slide. So DuPage County Health Department, Village of Bensenville, the Active Transportation Alliance, and they really recognize the importance of working across sectors from the beginning. So the coalition knew that their community needed to be active, but they also wanted to hear from the community members themselves. As an initial step, Be Well Bensenville launched a community-wide survey to determine specific policy recommendations and to prioritize community change. The survey was made by key stakeholders of the coalition to assess how residents travel to grocery stores, libraries, work, and trails, as well as how they would like to get to these destinations. The coalition knew that almost half of all residents speak a language other than English at home, and almost half of all Bensenville residents are Hispanic. In an effort to engage all community members, Be Well Bensenville developed all communications in both English and Spanish, and was able to collect a number of survey responses from Spanish-speaking residents. This is incredibly important to do because they wanted to make sure all voices were heard as a part of this project, not just certain voices. The comprehensive outreach approach to the data collection, including the survey in the local water bill, posting the survey on the village and library websites, engaging families in summer programs and local soccer leagues yielded a statistically significant return. So some of the survey results show that two-thirds of the residents identified better sidewalks as their priority, as there is a lack of safe routes between homes and schools. An analysis by the coalition showed that 37% of Blackhawk Middle Schoolers walk to school, yet within 1.5 miles of school there were 4 crashes involving pedestrians or cyclists and over 500 speeding violations from January 2011 to December 2013. In addition to better sidewalks, residents wanted more ways to move safely across the city streets. For example, there's a lack of sidewalks on major arterials. And respondents also indicated that streets and sidewalks really need to be improved. So the recommendations from the community received of the survey were incorporated into the Active Transportation Plan and the Complete Streets Policy, which helped the village focus transportation investments on the places that matter most. The coalition is currently focused on implementing these efforts and already using the new policies. For example, when the coalition found out about the village plans to resurface the streets, Be Well Bensenville was able to leverage their work to ensure that a new bike lane was incorporated in the plans. Be Well Bensenville's efforts also involved a regional perspective by including the potential to connect Bensenville with neighboring Elmhurst by the construction of a multi-use path. It was really important that the Active Transportation Plan and the Complete Streets Policy was on the books. Bensenville has only one planner, and so both the plan and the Complete Streets Policy gave a nice framework for moving forward and empowered the city to make changes to the infrastructure because they knew what to do. They heard from the community residents, knew that there would be buy-in. Bensenville is now looked to as an example of other municipalities in the Chicagoland region. The Active Transportation Alliance also created a Complete Streets Coalition, which the Be Well Bensenville Coalition participated in the formation in the group. The group hosts events, shares resources, and brings together health and planning professionals to advocate for complete streets. The next community I wanted to feature is in Columbus, Indiana. So Columbus, Indiana has a population of approximately 46,000. The most recent Community Health Needs Assessment in Columbus was conducted in 2015 and identified key risk factors that are linked with chronic disease. Nearly 40% of the population have been diagnosed with high blood pressure, and just under 84% have one or more chronic disease, cardiovascular risk factor. The needs assessment also indicated that only 49% of the population gets its recommended amount of physical activity. Columbus, Indiana has had a complete streets policy, a bike ped plan, and a safe routes to school comprehensive plan successfully adopted since 2010 to 2011. Yet in order for these policies to be implemented, the community needed to be engaged. The Reach Healthy Communities Coalition is dedicated to engaging residents and partners in building healthy, vibrant places through 3 key strategies: access to health care for all, promoting healthy lifestyles, and promoting healthy relationships. And as you can see on this slide too, this coalition had many folks from different sectors. So on here we have the City of Columbus, Bartholomew County Planning Department, the Parks and Rec Department, Healthy Communities, and various community members. So the goal of the coalition has been to improve pedestrian access to community by bridging the gap between policy adoption and implementation. The coalition focused on 3 distinct strategies, one being to analyze and design bicycle and pedestrian crossing treatments at 3 key intersections along a specified segment of the Columbus People Trail system that connect people to important area parks. They thought it was vital to involve the community who use this corridor and therefore publicize the event through social media, the local radio station, the newspaper, and sent flyers via direct mail. The open house was hosted at the Donner Center, which was central to the bicycle pedestrian route they were examining. The open house consisted of 5 stations where participants were asked to provide input. The first station involved individual maps of the study area, and participants were asked to draw their preferred east-west bicycle pedestrian route through the neighborhood. The station was intended to help gauge whether the team was focusing on the intersections that get the most use. And much to their surprise, the results revealed that several different east-west routes, thus there were several more than they actually thought, and which was exciting. So they were able to expand the scope of their work and move from 5 intersections that they were looking at to 8. Other stations, as part of the first open house, focused on specific intersections, and they provided context for intersections, aerial maps, photos of all 4 corners of intersections, asked for what purpose did they travel through the intersection, how comfortable they were with walking with a child through an intersection, and then what they believed the top safety issue was. The final station showed residents intersection improvement options and asked residents to vote for their favored improvement options. The results of the first public open house played an important role in shaping the project, informing the final draft recommendations that was then presented at a second open house, which was hosted in February of 2016. So they invited the community back. First, they listened to the community, asked them what they wanted to. We're looking at this area. How do you travel around this area? And as a result, they expanded their scope. They went back to the drawing board, included a couple of more areas to look at, and then came back to the community to hear what they thought of the final recommendations. So after presenting, the community provided feedback again on the final draft recommendations for improvements to 8 intersections within the study area. And the feedback was used from that second open house again to inform the final recommendations. So I really wanted to highlight the Columbus, Indiana folks because as a result from working with the community and hearing the needs, the coalition was able to have a dialogue with the community. They installed a hawk signal and they had a high visibility crosswalk, and the community's general excitement and ownership of the work also expedited other projects such as the installation of bike share and this transit center that's pictured here. The community conversations still happen through these facilitated community conversations rather than just public input. They're yielding better results. The coalition can go and present ideas and with the help of the community help formulate ideas into plans. This has also helped the coalition focus on who they are designing for, and the community is really now begging for traffic calming that allows them to safely access their streets and safe access to walk and bike. Before the Plan for Health project and before working with the community, they used to think they had a good system in place. Yet the Plan for Health funds, and through working with the community and working with this cross-sector coalition, they were able to re-examine the way they worked with the community and focusing on bike and pedestrian issues. Who are they including in these efforts? Who are they listening to? And then with this process, they're hoping that they can make positive change that will help institutionalize this process. So just a few tips I have listed on this slide. Have conversations rather than public input. Really listen to the community. Be flexible. So when you go in there and you have your plans, make sure that you're willing to change your plans if the community has other suggestions. And offer multiple opportunities for input. So Columbus had 2 community conversations and also an online survey folks could fill out. So this is my last slide, and I just want to end here that when you're working together, we know that a complete streets approach integrates people and place in the planning, design, construction, operation, and maintenance of our transportation networks. And this helps to ensure streets are safe for all people of all ages and abilities, and it needs to balance the needs of different modes and support local land uses, economies, cultures, and natural environments. Hopefully these examples demonstrated the need to involve communities to ensure streets are safe for all users. When working together to implement complete streets and build healthy communities, have a discussion around health equity, or as we define it at APHA, the opportunity for everyone to attain their highest level of health. Each community is different, and each challenge or opportunity is unique to that community, so make sure that you're working with them. Also, working together on a professional level, if you're working with a planner, or you're working from a public health perspective, do you know what their role is in that coalition? Do you know what the public health role is in that coalition? For example, we heard from one of the Plan for Health grantees that some of the planners gained understanding of the great tools that were also developed by public health folks, that they were able to provide data, and they were able to work together to talk to their local elected officials to say that certain things were a problem and unite and leverage their existing resources. And it ties together the 2 entities. And lastly, recommend working towards this shared vision. We're all trying to make our streets safer. We're all trying to encourage people to get out and walk or bike. And you may be coming at it from different perspectives, but knowing that you're working towards a shared vision should really support all of your efforts. And I just want to thank you again for having me on this webinar. Here's my contact information, and I wanted to give a special thanks to Elizabeth Hartig with American Planning Association, who helped me pick out which Plan for Health grantees to highlight for this webinar, because there are so many wonderful ones, and I hope you enjoyed it. Now I'll turn back to Emiko.
Thank you so much, Kate. That was fabulous. We are now going to move to the question and answer period. Again, if you have questions, please type them in the chat box. We have about 15 minutes left, so we'll not be able to get to all the questions because there's been so many good ones today. But again, we'll have a follow-up blog with a recording of the webinar today, as well as answers to many of the questions you asked. I'm going to take the moderator's privilege and ask Tim and Kate my questions first. Tim, I was really interested in kind of your presentation on redlining. That was a good reminder of the history. And I wanted to know if you knew what was the lasting impact of I-94 construction in Rondo.
Yeah, that's a great question, actually. So as you can see from that visual, it's a very wide interstate that when dissected that neighborhood. And so what's actually happened since then is the community, was still there, but they were just pushed to the side, and many were displaced. Thousands were displaced. But the community's still organized, and the community was still there, and they still have a lot of pride, as they should, and where they're from. And about 10 years ago, actually, Minneapolis and St. Paul were looking to expand their light rail to go and connect the Green Line between St. Paul and Minneapolis' downtowns, respectively. And when they were going through the planning, they were actually going to go and have very few stops within the Rondo neighborhood. So stops were going to be every half mile along the way, but once they got into the Rondo neighborhood, they were going to go and spread them out by a mile, which was just a huge disservice to the community. So the community really did come together. They organized. There's a great group with a group called Just Equity, the Central Corridor Funders Collaborative, the Community Stabilization Project. So this group came together and really pushed forward and advocated for additional stops within Rondo, and they were successful in that. And as a result of the community organizing, what was really exciting is that the city actually came out and acknowledged that they were wrong to not plan additional stops within Rondo, but they also apologized for what happened in the 1960s with I-94, which is pretty impressive when you think about it, with government to apologize for past injustice. Which is great. There's a great video that's out there, and we'll include that within the notes that go out for everyone. But really encourage you to watch this video and learn more about what happened in Rondo and the history and how that lasted an impact and how they were able to organize to make sure it didn't happen again.
Thanks so much, Tim. And I am going to ask Kate a question. Kate, what is one of the first steps to working with someone in public health on Complete Streets policies?
Yeah, that's a great question, and that's something I hear a lot as well. So if you haven't worked with your public health professionals yet, I encourage you to do so. They're fantastic, but I am partial. So what I would say when you're first working with someone from public health and you don't know where to start, you can start with your local health department, with the city health department, with the county health department, and you can approach someone in chronic disease prevention or injury prevention and just write them a note or give them a call and say, hey, I'm really interested in the connection between health and active transportation. Or if they don't know what active transportation means, you can just say, I'm really interested in how the health impacts of our transportation decisions, and I would like to have a meeting with you. And I think that first meeting where you can just go and you have a meet and greet and talk about what you each do in your work and in your world, you'll really start seeing the intersections. And once you learn more about each other and the role you play in making your community work well, making your community healthy, then you'll be able to figure out how best to work together.
Thanks so much, Kate. Tim, the next question is for you. The question reads, the speaker mentioned that equitable treatment and the definition of the same varies from community to community, especially defining needs, opportunities, community concerns, etc. How many federal and state funding programs that support planning and or implementation of Complete Streets come with prescribed rules and regulations regarding equity and equitable treatment in EJ populations? How do we reconcile the two effectively so rules are followed, funds are wisely spent, and community concerns are resolved in a positive, meaningful way?
Yeah, that's a great question. And so I think it all has to do with the jurisdiction in which you're trying to get the policy passed. So you're right, there's a lot of bureaucracy tied around federal dollars, federal transportation dollars, but and policy. But at the same time, states and cities still do have their own revenue. They still can execute their own policies. And so, the great thing about Complete Streets is that there's specific components in there tied to the connectivity. So it's not just connecting with other neighborhood or other jurisdictions around you, but also connecting the other funding options and projects that have cross those boundaries. So, yeah, I think it's, the one thing is if you are coming from the transportation world and you're really wanting to implement complete streets, but you're worried about the federal restrictions, definitely, work with your state DOT, work with the federal DOT, and help them understand what you're trying to accomplish based off of the feedback that you're receiving from your city administrators, but even more so from your community. And Emco, you might actually have some greater insight than I can share on that.
I do, Tim. I will put that in the resources in the blog post because we are getting more questions than I can keep up with, which is great. I am going to ask Kate the next question, but before I do, I wanted to mention we saw a lot of questions referencing all ages that I think, the Voices for Healthy Kids somewhat implies it's just focused on children, although Voices is focused on all ages. However, I also encourage all of you to look at the resources put out by our other steering committee member, AARP. If you go to the AARP Livable Communities website, and we'll include that information in the follow-up blog, they have a lot of great information on complete streets and working with all age communities, particularly those ages 65 age and plus. And as Kate mentioned, those 65 years of age or older, particularly people of color, are the most disproportionately impacted people in the country when it comes to pedestrian fatalities. So, Kate, the next question is, have you all found success in hosting walking conversations with community members, actually getting out and walking alongside residents as they share their stories?
I love this question, and the answer is absolutely yes. So I think one of the most powerful things you can do is go out with the community and hear from them. You could even do something like a photo voice project where you take folks out and they all have cameras and take pictures of issues they see when they're walking, biking, or rolling along that need to be addressed that you might not catch when you're just making GIS maps. Also, I suggest checking out planforhealth.us. I know a lot of our grantees worked with Mark Fenton, who is a powerhouse, and he hosted some of those types of community conversations out on the street, and they all talked about some of the issues they saw and some of the things that they liked. So this is a great way to not only hear from the community, also get some folks active and proud of what's happening on their streets. So I would highly recommend to do that.
And then if I can piggyback on your comments, Kate, I think the other thing is as you're going out and you're walking and having those discussions and you're perhaps conducting a walk audit, Charles Brown with the Voorhees Transportation Center, he shared on the Dangerous by Design webinar some guidance, and I really think those who are maybe looking at doing a walk audit should take that into consideration. And his advice was, if you do a walk audit, don't just do it during the middle of the day. Do it at all hours at night, because a lot of people who rely on safe, who need safe access to transportation are commuting and walking at night as they go to and from work or school. So keep that in mind that you need to look at all hours of the day when you conduct a walk audit.
That's a great point. Thanks for bringing that up.
Yeah, thanks so much, Tim and Kate. I'm going to take, again, the liberty as moderator of answering a few final questions before wrapping up. Again, mentioning for the third time, we will post answers to as many questions as we can in the follow-up blog. The final two questions I just wanted to address is a question about are there effective ordinances that mandate complete streets? Houston has a policy, but Public Works and Planning have a lot of discretion on implementation. I have some exciting kind of news that we haven't shared yet, but we're currently working to update our policy language and guidance to better reflect implementation and equity, and that will be coming out with our Best Complete Streets Policies report later this winter. So please stay tuned for that. I think that is something that we've recognized. I would also turn to the Voices for Healthy Kids resource. They do have policy bottom line language that emphasizes binding ordinances. So for the time being, I would look at the Voices resources as well as our own on www.smartgrowthamerica.org/complete streets, but we will be updating that. The last question that I wanted to address is, again, not so much an answer, but one of our cities is in the process of developing complete streets metrics. Are there standards for complete streets performance measures that ensure equity is also monitored? So that will also be coming out with our new guidance. But what I would look at is not just a lot of performance measures that I see have to do with number of sidewalk miles or sidewalk feet added, number of bike lane miles added, but look at where they're going and who's really benefiting. Look at not just injury and fatality data, but where it's happening. And then look at, if you're looking at mode shift, which is the amount of people shifting, say, from driving or transit to walking or biking or rolling, or look at who is doing that. I think that sometimes we need to dig a little bit deeper into our data and ask the who and the where, and not just the what. So I would definitely encourage all of that. I loved all the questions today, and if you want to learn more, this webinar series will continue throughout the year. We've got a lot of exciting programs planned around all ages in complete streets, the implementation of complete streets, funding complete streets. But we have 2 webinars coming up later. Next Tuesday, our partner organization, Transportation America, is hosting a webinar titled How Are MPOs Prioritizing Health? And APHA will be a part of that again. So while today's webinar on health and complete streets showed the powerful connection between our health and the built environment, it can be a challenge to plan, design, and build these projects that make biking, walking, rolling, and riding transit safer, more convenient, and more realistic. So this webinar will address how can regions bring more of these projects to fruition, how can they append perhaps decades of radically different priorities to make these types of projects the norm. So this was a paper produced by the American Public Health Association, so again, Kate's organization, with Transportation for America, and this paper outlines 4 policy levers that MPOs, or Metropolitan Planning Organizations, have at their disposal to help increase and improve active transportation projects. So that webinar is happening next week, next Tuesday, so 6 days from today. I believe it's around the same time, and you can sign up at t4america.org/healthymetros. And I'm excited to announce our next webinar, which will be in about 5 weeks from today. We're partnering with the design and engineering firm Stantec, who's also a steering committee member, to talk about creating value, assessing the return on investment in complete streets, which will be a really exciting, how do you begin to tell the story about how there is about the ROI on complete streets. And that's not just looking at economics, but it's looking at all of the return on investment. So please join us for that. We'll be sending out a registration information shortly. And with that, it is 2 o'clock on the dot, so I wanted to thank you all for sticking with us for this hour. We're, again, so excited to have launched this webinar series with Kate and Tim. So thank you, Voices for Healthy Kids Initiative, American Heart Association, Robert Wood Johnson, and the American Public Health Association, and all of you for joining us today. Stay tuned for more details and a follow-up blog. With that, have a good day.